Hi, I'm Rosemary Clay, the Executive Director for the Bergen Newbridge Medical Center Foundation, New Jersey's largest not for profit hospital, and the sponsor of In the Know It Row, an informative conversation with leading clinicians on important health topics. Today I'm joined by Darian Aletto. Darian obtained her master's in education from William Patterson University and is a licensed clinical alcohol and drug counselor and a licensed professional counselor. In her current role as Director of Outpatient Behavioral Health Services, she oversees the Acute Partial Hospitalization Program, Outpatient Behavioral Health Clinic, and Children's Intensive Outpatient Program. An important healthcare pivot that came from the pandemic was the increased use and acceptance of telehealth services to obtain care when people could not visit their providers in person. While medical virtual visits had already begun to take hold, using telehealth platform for mental health services was groundbreaking here at Bergen Newbridge. As one of the most well-respected and largest mental health providers, was at the forefront of adopting and offering this service. So Darian, share with us, how does telehealth work?
So, as many people have figured out and many people have experienced, and as you so rightfully said, Ro, telehealth became much more popular as a result of the pandemic as a way for us to receive care. So, those who aren't familiar with telehealth, telehealth is a utilization of when a provider conducts a service and they utilize maybe like a teleconferencing system, they use a phone system or through a designated telehealth platform, and they have certain firewall protections in these platforms that make them HIPAA compliant. So it's basically a virtual appointment.
Oh, that's great. That's great. So, what are some of the pros and cons to telehealth services?
Well, there's a lot. And I think part of learning the pros and cons was a big experience for us here at the medical center because we started to identify what works in telehealth and what doesn't, and then adjust our sales accordingly. So some of the pros are probably more the obvious things. Having the ability to have your services conducted from the comfort of your own home is a really great luxury. It's nice to not have to commute anywhere. It's nice to not have to worry about parking or worry about traffic. So it is a benefit to have that. And, in terms of commuting, some patients have to utilize public transportation, and that's not always super reliable for some people. So they worry about being late for their appointments, having to reschedule if they're so late. So that is a huge pro for a lot of people. Also, patients with physical limitations who maybe can't ambulate so well, having that ability to utilize a telehealth service from their home alleviates some of the stress of having to get to a location. Other benefits are that many insurances do support telehealth services. So you're covered, you can utilize the service and have that, ability to get care from home and know that your insurance is going to cover that service. It's super helpful. Patients also have an increased availability or can have more services because they don't have to go to an office. They don't have to go through like the check-in process. So for some patients, maybe they had a appointment with their therapist in the beginning of the week and something happened maybe midweek and they say, I really want to see my therapist again. Scheduling an appointment is a lot easier because you don't have to worry about physically showing up to an office. There's a lot more flexibility in scheduling. So that's another benefit that we've noticed from telehealth services. We also noticed that it's good for those who live in remote areas, maybe areas that don't have so much access to healthcare. You're able to get quality care all from the comfort of your home. And there's also the ability to have the convenience of feeling that you can make an appointment from your home. You can do everything from from your telephone, from your computer. That leniency to have maybe during your lunch session, you can get your medication refill done. So I think convenience is the biggest pro, but there's a lot of other positive things that come from it as well. Some of the cons that we've noticed is that there's a lack of that in-person connection. The golden standard for therapy, especially when I was in grad school learning how to be a therapist, the golden standard was in-person telehealth. In-person treatment, because there's so many nonverbal cues that maybe we don't see through a telehealth appointment. Right now you see me from, here up, maybe like, am I fidgeting my legs? Am I bouncing my legs? Am I playing with my hands? You don't really know because you only see a certain amount of what's going on in a telehealth service. In an in-person visit, you can see those nonverbal cues. And also with COVID restrictions right now, we're wearing a mask. And sometimes when our mouth doesn't say things, our face will say things. So
Mm-hmm.
you do miss that in-person connection. So that's one pro. A con. Another con that you might have is that you can't always guarantee HIPAA compliance. Yes, it's nice to take a telehealth appointment from your home, but maybe you live with more than one person and maybe they come in and out of the room. So maybe you don't have that privacy that you may need. It's not always easy to control the environment around us. Maybe you have a pet that's getting in camera, or, maybe you might have somebody who doesn't know you're in a telehealth service and in comes in the middle of your appointment. So, that's a con, not always being able to control the environment. A big con that can be super frustrating is connectivity issues. So maybe you don't have a great internet connection. Maybe you keep losing your connection to your therapist or your doctor. You're in and out of the room, so to speak. It really disrupts the process. So that's frustrating for the patient and it's frustrating for the therapist, because it interferes with the therapeutic process. So it's not always ideal. Some other cons that we've been identified is that not every insurance company accepts telehealth services. Some insurance companies will only pay for in-person services, as things especially start to change and, modify with the pandemic. Insurance companies change with that too. So it's always important to be in the know of what's going on with your insurance coverage. And also to the thing that clinically is most concerning, a con for telehealth, is the ability to respond to a crisis situation. We at the hospital here, it's a luxury that we have our services connected right next to our emergency room. So if we
Mm-hmm.
have a patient who's in crisis, maybe they're having, really intense suicidal ideation, maybe they need a psychiatric evaluation right then and there, we have the ability to walk our patients over to the emergency room. Or if you're in person, you can, maybe have the doctor come and see the patient right then and there. We're in the same space. We share our space with our doctors here in our outpatient department. So if a patient is in crisis and you're utilizing a telehealth modality, the ability to respond to a crisis situation in a more, immediate way is a little more limited. It's possible, but having that ability to intervene right then and there in an in-person visit really is a huge positive when we're working with somebody who's in crisis. So those are the major pros and cons that I can identify.
So just to talk about that in person and telehealth piece, what's the difference in getting an appointment? So is it easier to get a telehealth appointment, or is it easier to get an in-person appointment, or are they just about the same?
They're just about the same right now in our outpatient department. We're trying to make things equally as available. But now that telehealth is so popular, having that hybrid modality, people really want to utilize that resource. But, you also have things like a medication refill that can be done, 15 minutes over a phone. That's a much easier appointment to get than, maybe a full session. But still, we accommodate as quickly and as soon as we possibly can. So it's not impossible, but there's definitely a difference between, availability, but we're kind of seeing it's the same right now.
Okay, that's
And
fair.
especially too, depending on the type of appointment, like for an intake appointment, like your first time meeting the doctor, it's preferred that you come in person for that intake appointment because the doctor wants to kind of see how you're doing in person, make their clinical observations right then and there. And then after that, you can adopt a more telehealth approach. But initially, we always want to see our patients in person just to get a good baseline.
Got it. So how does telehealth impact behavioral health services?
It's a great question because a lot of people are talking about, is it as effective? Does it work as well? Like, will I lack that personal connection with my therapist? So some studies have shown that CBT, cognitive behavioral therapy, is just as effective in person as it is through telehealth. Cognitive restructuring can happen through any modality. It's very, very effective. But, also what we notice is that maybe the patients who have more anxiety based symptomatology might improve, like might not that they'll improve more, but they'll have more impact through a telehealth service because, if you're having any kind of panic disorder, social anxiety, generalized anxiety disorder, maybe you have agoraphobia, which is, the fear of leaving the house. Having that service can help alleviate some of those symptoms because you feel more in control of the environment and you're
Mhm.
more willing to go to therapy because you're in your comfort zone. Obviously you work with your therapist to learn how to get out of your comfort zone and be comfortable in that, but those therapeutic interventions through telehealth can be just as effective.
Wow, that's great. That's great. And then you bring out a really good point because, you don't want those triggers and then it to interfere with, the therapeutic stages of it. So that's a great point.
Mhm.
So can therapy be effective if it's done via telehealth? And can you give us some examples? So you mentioned CBT.
Mhm. It can be. I think also too, when you alleviate some of the stressors of getting into a therapist office, and kind of like you said, that was really well said. Like those initial stressors of getting into the office, having those triggers of being, in a space that you don't feel comfortable, it can be effective. It can allow a person to feel more comfortable to share what's going on internally because they feel I'm in an environment that's safe, whether that's their home environment, wherever it may be, but being in an environment that they feel they have more control of, and then allowing themselves to process can be very effective. And for some people, being in person with a therapist can be intimidating. Now, therapy is a total, like we walk in and we are two equals. Therapist is not above a patient. But some people see a hierarchy in treatment, and maybe it's less intimidating to talk to somebody through a phone or through a camera than it is to look at them in person. It can be kind of intimidating, especially if you're talking about, deep seated, emotional traumas or working through really triggering situations. So telehealth can be really effective, especially because it helps alleviate some of the external stimuli that might make the therapeutic setting a little more triggering.
And that's a great point. I mean, there's so many triggers to people that are going through trauma, and being in your own environment can be such a plus. And to get them to the point of wanting to come in person is a win. At the end of the
Yeah.
day. So what are some tips you can give us on a better telehealth experience?
This is, I think, a really important thing to talk about because I think we as consumers just show up and we think, okay, I'm going to come to tell my telehealth appointment now and everything's going to be going well. Well, there's some things that are kind of like telehealth etiquette. So some tips might be, protect your privacy by choosing a setting that you can control the environment a little bit better. I wish I could tell you how many telehealth sessions I've had patients in their cars because they feel like I'm in my car, no one can bother me, no
Yeah.
one's gonna interfere, I can lock my doors. So it is really helpful for you to be in an environment that you can kind of control and keep quiet and maintain the surroundings. Um, Find a spot free of distraction. So, like if you have a pet, if you have, I know with children, it's probably super hard to have an area free of distraction. But if you can kind of like carve out that time and make it personal to you, that's super important. Wearing headphones can be really helpful because sometimes, especially if you're in a therapy session, maybe you don't want someone you're sharing the space with to hear your therapist feedback. Maybe you just want to be able to hear it very well, which is great. Super important for you to hear your therapist feedback and for them to hear you. Also, making sure that you keep a notebook handy, that can be very helpful. Writing down notes from your session, which you can do in person as well. But I think when you're home or you're in your own environment for telehealth, it can be easier to maybe write things down, take notes on what's really important, what you want to work on following your session. Also, asking your therapist questions about, what can I expect from, our therapy sessions? What can I expect from our goals, and what changes will I see through our therapeutic relationship? So that's kind of an important thing about therapy too, knowing what to expect and asking your therapist questions about how will this work? What happens if I lose connection? What's our next step? What's the go-to if, my connection is not great? Can you call me on my cell phone? Having that plan with your therapist if maybe your telehealth service isn't working properly. So also asking what like your next steps are.
So you brought out a good point about children. I mean, I know that that's been an obstacle for a lot of people to get therapy. So to have that option of having telehealth and not worry about childcare is huge.
Yeah.
I mean, it's really a big piece and that was a great point. So thank you for that. So what does research say about telehealth itself?
It's really interesting because what I kind of saw in my research leading up to our session is that a lot of the research that I found that was more mature and early on is from the early 2000s when we first start seeing a little bit of utilization of telehealth. Obviously, it wasn't the go-to form of therapy, but there is research from the early 2000s that show that therapy that's done through telehealth can be just as effective as in-person therapy. Now, of course, we're finding that there's a lot more studies being done recently because of everything with COVID and this being the main form of treatment for almost 2 years now. So there's a lot of maybe more younger premature data or smaller case studies that have shown that again telehealth can be very effective. It's very useful. It's a modality that a lot of people feel more comfortable with, especially with the pandemic. People are finding that those who maybe have increased health risks, who maybe have more concerns about getting COVID or catching COVID, having that ability to stay in an environment that they feel is safe has been helping alleviate some of those stressors. And also too, what we noticed here in outpatient is that we found that patients that maybe are more reluctant to coming into a medical center setting because for fear of, exposing themselves or their loved ones, they found that having the option of telehealth was a huge help for them and made them more inclined to come to services. So it's finding, a lot of research is finding that patients are more inclined to follow up with services if they know it's telehealth because they know that there's convenience and they know that there's safety. So it's interesting stuff. Again, we're not going to probably know anything solid for another couple of years because, again, if you're doing a larger study, it's going to take a little bit more time to get some real secure data.
That makes sense. It makes sense.
Mm-hmm.
So when might telehealth not be a good option for someone?
And I think that's an important thing to consider. Just as important as having the option of telehealth is also knowing when it's not such a good option. So for those who are receiving maybe medically assisted treatment like Suboxone or Vivitrol or something like that, that's something that needs to be monitored a little more closely by a doctor. So being on certain medications might make in-person treatment a better option. Just because you could be monitored, make sure that your health and safety are at the topmost priority. That might be a better option, for in-person. For those who are on injectable medications, you have to come in to get the injection because the nurse has to administer it. So that's when in-person visits are more important than the telehealth option. And for those who might be high risk for suicidal ideation or suicide attempt, it's best to have, again, like we said earlier, it's best to have somebody come in person because we can evaluate them more clearly. We can see what's going on. We can observe them and see how, their presentation is. And again, if we need to get a more immediate psych evaluation, we can connect them to that resource, that crisis intervention in the moment, as opposed to having the delay of, in using an intervention in the community. So that might be, those might be times that a telehealth might not be the best option.
And eventually, once the person is, it's not a good option, will they have the option to change over to telehealth?
Sure. Of course, a lot of these things are at the discretion of the doctor. So when the doctor feels as though the patient has stabilized enough, they feel as though they're not a threat to themselves or somebody else, they can say, hey, we can use telehealth. And we see that a lot in our outpatient department. Maybe we have patients who are having more severe symptomatology. The doctors want to see them in person once they're maybe more stabilized on their medication, or maybe they're utilizing their coping skills in a healthier way. The doctor can say, you know what? Let's do a telehealth session and see how that goes. And again, it's always trial and error. Let's say the telehealth session doesn't feel as productive as an in-person visit. You can always switch back. We really utilize a hybrid modality in our outpatient department because we understand that each case is different because each patient is different. So we try to accommodate as best that we can.
Great point. Great point. So what are some of the behavioral health telehealth services here at Bergen Newbridge Medical Center?
So currently in our outpatient department, we are offering medication management through telehealth. We are offering individual therapy services through telehealth. We do have some groups that are run through telehealth, which is really, really interesting. And we also have psychiatric follow-ups and intakes through telehealth. Now, like I said, we try to do our initial psychiatric intakes in person because we want that patient to be seen so the doctor can get a real view of what's going on with the patient. But we do understand that sometimes there are circumstances such as transportation. Maybe they have, mobility issues. So we, again, try to accommodate every patient as best we can because we understand that every patient is different.
So tell us a little bit about the group sessions. That's interesting.
Yeah.
How do you do a group session in a telehealth?
Well, it's so interesting. We are running group sessions that might be for the age groups of 40 plus, and that particular group, because of COVID and because of fear of exposure and knowing that, your age does impact your susceptibility to COVID and maybe some complications, what happened is that group collectively said, like, hey, we feel more comfortable with our group being run via telehealth. And the facilitator, who is fabulous, said, of course, I totally understand. And the group understands that this modality is through telehealth. So they understand that maybe they have to be, their treatment's going to be a little different, but they all understand that the shared goal is to be in treatment together. So they respect one another to utilize the telehealth modality. So it's actually a group dynamic that really makes it work, and a group understanding that we are collectively using telehealth because we understand that for us, it's going to be more effective.
That's
So that's
awesome.
one of our really cool cases that we're working on.
That is really cool. That truly is. And you really tailored it to the patient. I mean, you heard the need, and you said let's think outside of the box and provide the service to a population that feels more comfortable. So that kudos to you guys. That's great.
Thank you.
So
yeah, our
what
clinicians are really, really,
I
they
mean,
adjust their
really,
skills so well.
yeah, that's really great that you pivoted. I mean,
Yeah.
it's difficult. So,
Mhm.
what are some of the trends you've noticed as a mental health care provider utilizing telehealth services?
I think overall, we noticed that patients really do enjoy the convenience of telehealth, and they understand that in person sometimes is needed. So yes, it's great to have that telehealth option. We're happy to provide it. But I think also sometimes patients recognize that I need to see my doctor in person. I need to see my therapist in person. And I actually have a number of patients who are prefer to be seen in person, which we think is great. We love seeing the patients. We love having them here. But we also are noticing that a lot of interventions that we would utilize in person, therapeutic interventions, are just as effective through our telehealth services. So we also like to think that, patients are very communicative in their needs, and those who are able to express like, hey, I need to come in, I need to see you, we're always able to fluctuate and like figure out what we can do to make sure that they get in here. We make sure that they're seen. And if they don't want to use telehealth anymore, they're honest with us. So I've also noticed that it's kind of becoming the norm. When COVID first started, I was working as a clinician in our acute partial hospital program. And it was just such an odd thing to think that therapy is going to be effective through a telehealth modality because, like I said, in grad school, they just nail it in your brain like gold standard. You see that person in the flesh, you're in the room with them, and you use what's in the room. And to kind of see how telehealth has taken off and how successful telehealth can be, even when you're not with that person and you can still build a therapeutic connection, it really is so encouraging because it shows that no matter what, if a patient is willing to do the work, regardless of the modality, it's gonna be effective. So I think that's super encouraging. I'll never forget when COVID first hit and we were all, trying to figure out, what's going to happen next. One of our patients asked us, did they teach you about this in school? And, yes, we do. Like, we go over telehealth, briefly, but, that was back in 2016, 2017 when, we didn't even think about this stuff. So you cover the basics like the HIPAA compliance, the ethics and stuff. But, nothing really prepares you for a global pandemic, but the resilience of our behavioral health patients is so encouraging and really shows that telehealth can be such a benefit for patients, but also there is still value in in-person sessions.
That's incredible. That truly is. I mean, to be able to find the perfect combination is great. It really is. So we didn't mention anything about age group.
Sure.
Telehealth. Do I know we care for children here, but how early do we use telehealth services here?
So, like I said, we always try to do initial intakes in person, especially when it comes to kids, because we want to see what's going on with the whole patient. Also, too, what's the dynamic look like between patient and parent, patient and family. But a lot of what we're seeing is that many children do prefer an in-person visit, and also parents prefer an in-person visit. I think that children are so oversaturated with technology these days that to see somebody in person can be really encouraging and really healthy for a patient. Right now, our children's intensive outpatient program, the Hope and Resiliency Center for Youth, we are seeing our patients in person because we identify that because these children are in a more intensive level of care, to provide them the service in person is more appropriate because maybe these children are dealing with more severe symptomatology, maybe they're at higher risk. So having them in person and letting them see the doctor in person, letting them see their peers in person, because it is a group treatment modality, letting them just have that interaction with their peers and our clinicians in person makes so much difference, because these children are hybrid in school, or maybe they're at school all day but they don't really get that socialization component. So having the certain services for children in person has proven to be more effective and more helpful for children, because there is so many other telehealth modalities that they're using in other areas of their life.
Got it. I
Yeah.
mean, that makes total sense. It truly
Yeah.
does.
Mhm.
So, how does someone go about getting our first initial telehealth services? Who should we call, Darian?
So I would recommend calling the Access Center. That is our behavioral health access center. They always schedule our initial appointments. And they are very helpful. They're very kind, and they always make sure that our patients get seen. Um, I see that you have the number for our Access Center right there. So please
Yeah.
call our Access Center if you're looking for initial intake services. And they'll do a screening and they'll let you know about the services. They'll let you know when your first appointment is. They'll ask you if it's telehealth or in person. Again, we do like to get the okay from our doctors when we schedule a telehealth intake, because again, they're the provider and they kind of, make sure that the treatment is going well. So, it is an option, but it's not generally the standard, because, it's always good to have a good working relationship start from a face-to-face visit.
Very true. Very true. Well, this was really informative. I've learned so much about telehealth, and it's great just knowing that there's access to therapy
Yeah.
on any level, and it really tailored to the person. So, thank you for sharing that with us.
Anytime.
And if you'd like to learn more about Bergen Newbridge Medical Center and our services, please visit us at newbridgehealth.org. And of course, please support us at the foundation. It would be greatly appreciated. And thanks again, Darian.
My pleasure.